Good health rarely disappears overnight. More often, your body begins whispering long before it starts screaming. And one of the places those whispers appear first is somewhere most people never think to look: your fingernails. Not because they're simply growing differently with age, but because the tiny blood vessels, nerves, and tissues beneath your nails often reflect changes happening throughout your entire body. As a neurologist, I've spent more than 2 decades caring for adults over 60. Again and again, I've met patients who believed their fatigue, numbness, or shortness of breath was just part of getting older. Yet in many of those cases, the earliest clue had been visible for months, sometimes even years. It was right there on their hands. Today, I'm going to show you 4 nail changes that deserve your attention after age 60. Some may point to nutritional deficiencies. Others can be linked to diabetes, heart disease, chronic lung conditions, or problems affecting your nervous system. Now, one important note before we begin. None of these nail changes can diagnose a disease by themselves. Many harmless conditions can also affect the appearance of your nails. But when these changes appear together, or when they're accompanied by symptoms such as unusual fatigue, unexplained weight loss, persistent numbness, or difficulty breathing, they become important signals that shouldn't be ignored. By the end of this video, you'll know exactly what to look for, why these changes happen, which medical tests are worth discussing with your doctor, and one simple 10-second self-check that every adult over 60 should know. Stay with me until the end, because the final warning sign is one many people dismiss as a normal part of aging, when in reality, it has helped doctors detect life-threatening illnesses while they're still treatable. Before we begin, tell me in the comments, how old are you today? And have you noticed any changes in your nails over the past few years? I read as many comments as I can, and your experience may help someone else realize they should pay attention too. Now, let's begin with number 4. And surprisingly, it's one that many people mistake for nothing more than brittle nails. Warning sign #4. Spoon-shaped nails could mean your body is running out of iron. Let's start with a nail change that many people overlook because it develops so slowly. Take a close look at your fingernails. Now turn your hand sideways. Do any of your nails appear flatter than they used to? Or perhaps the center dips inward while the edges curve slightly upward, almost like a tiny spoon capable of holding a drop of water. Doctors call this Koilonychia, more commonly known as spoon nails. Although this shape can occasionally be inherited or caused by repeated trauma, in adults over 60, it often raises concern for one of the world's most common nutritional deficiencies: iron deficiency. Most people think iron only affects energy levels. But iron does much more than help you avoid feeling tired. It is essential for producing hemoglobin, the protein inside red blood cells responsible for carrying oxygen from your lungs to every organ in your body. Without enough iron, your body has difficult choices to make. It naturally prioritizes vital organs like the brain and heart. Less essential tissues, including your hair, skin, and nails, receive fewer nutrients. Over time, the nail matrix, the living tissue where new nails are produced, cannot build strong, healthy keratin. The nail gradually becomes thinner, softer, and eventually starts losing its normal curved structure. That subtle spoon shape may appear months before anemia becomes severe enough to cause obvious symptoms. And that's exactly why doctors pay attention to it. After age 60, iron deficiency becomes far more complicated than simply not eating enough spinach. Many older adults produce less stomach acid than they did in their younger years. Certain medications, especially long-term acid reducers, can further decrease iron absorption. Even if you're eating iron-rich foods every day, your body may not be absorbing enough of it. In other cases, iron deficiency may signal hidden blood loss from the digestive tract, making proper medical evaluation extremely important. This is why doctors don't simply recommend iron supplements without first looking for the underlying cause. I remember a patient I'll call Linda. She was 72 years old and complained of feeling exhausted almost every afternoon. She assumed retirement had simply made her less active. Her family thought she was just slowing down with age. But during her examination, one detail stood out. Several of her fingernails had developed a shallow spoon-like shape. Blood tests later confirmed significant iron deficiency anemia. More importantly, additional evaluation discovered a small bleeding stomach ulcer that had gone unnoticed for months. Treating the ulcer solved the problem. Within a few months, her energy improved dramatically. Even her nails slowly returned to a healthier appearance as new nail growth replaced the damaged sections. Stories like Linda's remind us of something important. The nail change itself wasn't the disease. It was the body's early warning system. So, how can you check your own nails? Find a bright light. Hold your hand at eye level. Look across the surface of each nail instead of looking straight down. Healthy nails should have a gentle, natural curve. If several nails appear unusually flat or begin curving upward around the edges, especially if you also experience fatigue, dizziness, pale skin, feeling cold more often than usual, or becoming short of breath during simple activities, it's worth discussing with your healthcare provider. Rather than guessing, ask whether you should have a complete blood count, ferritin level, and other iron studies. These tests provide a much clearer picture than simply assuming you're low in iron. And if your doctor confirms iron deficiency, resist the temptation to rely only on supplements. Your healthcare team should also determine why your iron is low in the first place. Here's another simple habit that may help if your doctor recommends increasing dietary iron. Try pairing iron-rich foods such as lean beef, beans, lentils, or spinach with foods rich in vitamin C, including oranges, strawberries, kiwi, or bell peppers. Vitamin C improves the body's ability to absorb non-heme iron from plant foods, making every meal more effective. But here's where things become even more interesting. Iron deficiency isn't the only condition that changes the appearance of your nails. Sometimes the color of the nail tells an even more important story than its shape. And the next warning sign has been associated with conditions affecting the liver, the heart, and even blood sugar regulation. Let's move on to warning sign number 3. Warning. Sign #3. Mostly white nails could be telling you something about your heart or liver. Now let's move to something that's even easier to notice. Not the shape of your nails, but their color. Take another look at your fingernails. Healthy nails usually have a soft pink color beneath the nail plate, because thousands of tiny blood vessels lie just underneath the surface. But what if that pink color begins to disappear? If most of the nail starts looking pale, cloudy white, or almost milky, with only a narrow pink or reddish band remaining near the tip, you may be seeing what's known as Terry's nails. This nail pattern has been recognized by physicians for decades. While aging alone can cause subtle color changes, Terry's nails have also been linked with conditions such as chronic liver disease, heart failure, type 2 diabetes, and chronic kidney disease. So, what causes this change? It comes down to circulation. Your nail bed contains a rich network of tiny capillaries that continuously deliver oxygen and nutrients. When certain diseases affect blood flow, protein balance, or circulation, these tiny vessels become compressed or less visible. As a result, the healthy pink color gradually fades. Your nails begin looking much whiter than normal. Think of it this way. Your nails are like a window. When blood flow underneath that window changes, the color you see changes too. One condition where this happens frequently is chronic liver disease. The liver produces proteins that help regulate fluid throughout the body. When liver function declines, fluid balance changes, circulation is altered, and the appearance of the nail bed often changes long before obvious symptoms appear. Heart failure can produce a similar effect. If the heart isn't pumping efficiently, circulation to the smallest blood vessels becomes less effective. Again, the nails may lose their healthy pink appearance. Many people are surprised to learn that diabetes can also contribute. Persistently elevated blood sugar damages small blood vessels throughout the body. The eyes, the kidneys, the nerves, and yes, even the tiny vessels beneath your fingernails. One of my patients, let's call him Michael, was 69 years old. He scheduled what he thought would be a routine annual physical. He felt reasonably healthy. He still worked in his garden several days each week. He wasn't experiencing chest pain. He wasn't unusually short of breath. During the examination, however, his physician noticed that nearly every fingernail appeared unusually white. Instead of dismissing it, additional testing was ordered. An echocardiogram showed that Michael's heart was pumping much less efficiently than expected. He had early heart failure. The good news? Because it was discovered before severe symptoms developed, medication, dietary changes, and regular exercise helped stabilize his condition. Years later, he remained active with his grandchildren. The nail change didn't diagnose the disease. It simply encouraged the doctor to look deeper. That's exactly how these warning signs should be used, as an invitation to investigate, not as proof of illness. So what should you do if you notice your nails becoming much whiter than they used to be? First, compare them with older photographs if you have any. Gradual changes are often difficult to notice because we see our own hands every day. Next, pay attention to other symptoms. Do you tire more easily than before? Have your ankles become swollen? Do you become short of breath while climbing stairs? Have your appetite changed? Have you noticed yellowing of your skin or eyes? Any combination of these symptoms deserves medical attention. Your doctor may recommend simple blood tests to evaluate liver function, kidney function, blood sugar, and protein levels. Depending on your symptoms, they may also suggest heart imaging or additional cardiovascular testing. The earlier these conditions are identified, the more treatment options are usually available. And there is something every adult over 60 can begin doing today that benefits both the heart and liver. Stay physically active. Even a brisk 30-minute walk most days of the week improves circulation, supports blood sugar control, reduces fatty liver risk, and strengthens heart function. Small daily habits truly matter. Now, if the previous warning signs reflected problems with oxygen delivery and circulation, the next one tells a very different story. Instead of revealing what's happening in your blood vessels, it may reveal what has happened inside your body over the last several months. In fact, your nails may be quietly recording your medical history without you even realizing it. Let's take a closer look at warning sign number 2. Warning. Sign sees 2. Horizontal lines across your nails could be a sign of diabetes or nerve damage. Now we're getting into the warning sign that many people mistake for nothing more than old nails. Run your fingertip gently across the surface of one of your fingernails. Don't just look. Feel it. Do you notice one or more horizontal grooves stretching from one side of the nail to the other? Not vertical ridges, which become very common as we age. I'm talking about deep lines that run straight across the width of the nail. Doctors call these Beau's lines. Unlike many cosmetic nail changes, Beau's lines often tell us that something interrupted your body's normal nail growth. Think of your nail like a tree. Every day, your nail grows a tiny amount from an area beneath the skin called the nail matrix. When your body is healthy, growth continues smoothly. But if your body experiences significant physical stress, such as uncontrolled diabetes, a serious infection, major surgery, severe nutritional deficiency, or another systemic illness, that growth can temporarily slow down or even stop. When it starts growing again, it leaves behind a horizontal groove. In other words, your nail records that stressful event, almost like a timestamp. It's your body's version of writing history. For adults over 60, one of the most common reasons doctors pay attention to recurring Beau's lines is poorly controlled type 2 diabetes. Many people think diabetes is simply high blood sugar. In reality, elevated glucose affects nearly every organ in the body. Over time, it damages the smallest blood vessels that supply oxygen and nutrients to delicate tissues, including the nail matrix. When those tiny vessels don't function properly, nail growth becomes irregular. At the same time, high blood sugar also damages nerves. This condition is called peripheral neuropathy, and it's one of the leading causes of disability among older adults. As a neurologist, I've cared for countless patients who told me the same story. My feet just feel a little numb. My toes tingle at night. I thought it was just old age. But healthy nerves don't stop working simply because you celebrate another birthday. Most of the time, there's a reason. And the earlier that reason is identified, the better the chance of slowing, or even preventing, further damage. I remember a patient named Susan. She was 66 years old and came to my clinic because of a strange burning sensation in both feet. It wasn't severe, mostly uncomfortable at night. She had ignored it for nearly a year. During the examination, I noticed several horizontal grooves across multiple fingernails. Not one nail, nearly all of them. That immediately suggested something affecting her entire body, rather than a simple injury. Blood tests showed her HbA1c, a measurement of average blood sugar over the previous 3 months, was well above the healthy range. She had been living with type 2 diabetes without realizing it. Fortunately, we caught it before severe nerve damage developed. With medication, healthier eating, weight management, and regular walking, her blood sugar steadily improved. Within a year, the burning sensation had become much less frequent. Her newest nail growth also appeared smooth and healthy. Again, the nails weren't the disease. They were simply pointing us in the right direction. If you notice Beau's lines, don't panic. Ask yourself a few questions. Have you recently had a major illness? Were you hospitalized? Did you undergo surgery? Were you severely ill with COVID, pneumonia, or another infection? Have you unintentionally lost weight? Or have you been experiencing increased thirst, frequent urination, blurry vision, or numbness in your hands or feet? These clues help your doctor understand what may have happened. If no obvious explanation exists, it's reasonable to discuss testing for diabetes. An HbA1c test is often much more helpful than checking blood sugar just once, because it reflects your average glucose over approximately 3 months. And if numbness or tingling is becoming more noticeable, your physician may recommend additional neurological evaluation, before permanent nerve damage occurs. One of the simplest habits you can start today requires no expensive equipment. Walk. Even 20 to 30 minutes each day can improve insulin sensitivity, increase circulation, strengthen muscles, and support healthier nerve function. Movement is one of the most powerful forms of medicine we have. Now, the final warning sign is the one that concerns me the most, because unlike the others, it may point toward diseases affecting your lungs or heart that can remain completely silent until they become dangerous. There's a simple self-test that takes less than 10 seconds. Every adult over 60 should know how to do it. Let's look at warning sign number 1. Warning. Sign #1. Clubbed fingernails could be your body's way of saying it's not getting enough oxygen. We've reached the nail change that concerns doctors the most. Not because it's common, but because when it appears, it should never be ignored. I want you to do a simple test with me. Raise both hands. Now place the nails of your index fingers against each other, nail to nail. Look closely at the small space between them. Normally, you should see a tiny diamond-shaped opening where the nails meet. Doctors call this the Schamroth window. If that little diamond is missing, or your fingertips appear swollen and the nails curve downward over the ends of your fingers, you may have what's known as nail clubbing. Many people discover this by accident. They assume they've always had nails like that. Others think it's simply another change that comes with age. But true nail clubbing is not considered a normal part of aging. It deserves medical attention. So, why does it happen? To understand that, imagine your body trying desperately to solve a problem. Your blood is responsible for delivering oxygen to every tissue. When the lungs or heart can no longer supply enough oxygen efficiently, your body begins releasing chemical messengers that stimulate the growth of tiny blood vessels beneath the fingertips. At first, this response is meant to help. But over time, those tissues become thicker. The fingertips enlarge. The angle of the nail changes. Eventually, the nail begins curving downward over the swollen fingertip. It's a slow process. Most people never notice it happening. Doctors often recognize it long before patients do. One of the most important conditions linked to nail clubbing is lung disease. This includes lung cancer, chronic obstructive pulmonary disease, COPD, pulmonary fibrosis, chronic lung infections. But the lungs aren't the only organs involved. Certain heart conditions, especially those that reduce oxygen delivery, can also produce clubbing. That's why physicians never look at this finding in isolation. Instead, they ask a much bigger question. Why isn't this person's body getting enough oxygen? I once met a patient named Richard. He was 70 years old, a retired mechanic. He had stopped smoking almost 20 years earlier and believed the damage was behind him. He exercised several times each week. He had no pain, no coughing fits, no dramatic shortness of breath. During a routine physical exam, however, his family physician noticed something Richard had never paid attention to. His fingertips looked slightly enlarged. When the doctor performed the Schamroth test, the normal diamond-shaped window had disappeared. Because of that single observation, Richard underwent a low-dose CT scan. The scan revealed a very small lung tumor. It hadn't spread. It hadn't caused symptoms. It was discovered early enough for surgery to remove it completely. Months later, Richard told his doctor something I'll never forget. I almost canceled that appointment because I felt perfectly fine. That's the danger. Many serious lung diseases remain silent until they're already advanced. Early detection can completely change the outcome. Now, it's important to remember that not everyone with clubbed nails has cancer. Far from it. Some people develop clubbing because of chronic inflammatory bowel disease, others because of congenital heart disease, some because of long-standing lung conditions that have nothing to do with cancer. The point isn't to assume the worst. The point is to investigate the cause. If you notice clubbing, especially if it's a new change, don't wait to see if it goes away. Make an appointment with your healthcare provider. Depending on your medical history, your doctor may recommend a chest X-ray, a low-dose CT scan, lung function testing, blood oxygen measurement, heart evaluation. These tests are far more valuable than guessing. And here's something especially important. If you're over 50 and you've ever smoked, even if you quit years ago, you may qualify for annual low-dose CT screening for lung cancer. Many people don't realize this. Ask your doctor whether you're eligible. That conversation could save your life. Now let's step back for a moment. We've talked about 4 different nail changes. Individually, each one can have several possible causes. But when 2 or more appear together, the picture becomes much more meaningful. For example, spoon-shaped nails along with persistent fatigue may suggest iron deficiency that's affecting your entire body. Very pale nails combined with ankle swelling and shortness of breath may point toward heart or liver disease. Beau's lines together with numbness or burning in the feet may suggest diabetes that's already beginning to affect the nerves. And clubbing, combined with unexplained weight loss, a chronic cough, or D. Final summary. Your nails could be telling you more than you realize. Before we finish, I want you to take one more look at your hands. Not with fear, not with anxiety, but with awareness. Your fingernails may seem like a small part of your body, yet they can sometimes reveal changes happening beneath the surface, long before symptoms become impossible to ignore. Today, we've discussed 4 important warning signs. First, spoon-shaped nails. These may suggest iron deficiency, especially when accompanied by fatigue, dizziness, feeling cold, or shortness of breath. Left untreated, iron deficiency anemia can reduce oxygen delivery throughout the body and gradually affect your energy, concentration, and heart health. Second, nails that become unusually white across most of their surface. This pattern has been associated with conditions involving the liver, heart, kidneys, and diabetes. While not diagnostic on its own, it deserves medical attention when combined with swelling, fatigue, or changes in breathing. Third, horizontal grooves known as Beau's lines. These grooves often tell the story of a significant stress your body experienced weeks or even months earlier. They may appear after serious illness, but they can also be linked to poorly controlled diabetes, nutritional deficiencies, and diseases affecting the nervous system. And finally, nail clubbing. The warning sign that concerns physicians the most because it may reflect chronic lung disease, reduced oxygen levels, certain heart conditions, or, in some cases, lung cancer. Remember, none of these nail changes automatically mean you have a serious disease. Many harmless conditions can affect the appearance of your nails. That's why it's so important not to diagnose yourself based on a YouTube video. Instead, think of these changes as reasons to start a conversation with your healthcare provider. Early evaluation often leads to early treatment, and early treatment almost always offers better outcomes than waiting until symptoms become severe. So, what can you do starting today? Begin with a simple monthly self-check. It takes less than 2 minutes. Look at your nails in natural light. Pay attention to their color, their shape, their thickness, their texture. Notice whether changes involve just one nail or several. If possible, take a photo every few months. Sometimes gradual changes are much easier to recognize when you compare pictures taken over time. Next, take care of the habits that protect your entire body, not just your nails. Eat enough protein. Include iron-rich foods if your doctor recommends them. Manage your blood sugar. Stay physically active. Don't smoke. Limit alcohol. Sleep well. And keep up with routine medical checkups. These simple habits support your heart, your brain, your nerves, your lungs, and yes, even healthy nail growth. One lesson I've learned after years of caring for older adults is this: the healthiest patients aren't always the ones who never develop medical problems. They're the ones who notice changes early and take action before those problems become emergencies. Your body is constantly communicating with you, sometimes through your energy, sometimes through your balance, sometimes through your memory, and sometimes through something as small as a fingernail. Learning to recognize those signals isn't about becoming worried. It's about becoming informed. Because information gives you choices, and those choices can make an enormous difference in how you age. Before you leave, I'd love to hear from you. Which of these 4 nail changes surprised you the most? Have you ever noticed any of them on your own hands, or perhaps on someone you love? Share your experience in the comments below. You never know who your story might encourage to seek medical advice at exactly the right time. If you found today's video helpful, please take a moment to like this video, subscribe to Dr. Nathan Ashford, and turn on notifications so you don't miss future, evidence-based health advice designed specifically for adults over 60. And if you know someone, a parent, spouse, sibling, or friend, who rarely pays attention to their health, please share this video with them. It could prompt a conversation that leads to an earlier diagnosis and a healthier future. Thank you so much for spending your time with me today. Take good care of yourself. Stay curious about your health, and I'll see you in the next video.